Have you ever thought about how your allergies might be affecting your eyes? On this special episode of OCuTALK, we'll be discussing how different kinds of allergies and environmental allergens can impact our eyes with allergist Dr. Payel Gupta. Dr. Gupta?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us from New York, Dr. Payel Gupta. Dr. Gupta, thank you so much for joining us today.
Thank you for having me.
Excellent. And again, it's great to have you on here, Dr. Gupta, because you're actually our first allergist here on OCuTALK. So thank you again for joining us. And before we get started, though, I was hoping that maybe you can explain to our audience a little bit about your background and your specialty.
So I am an allergy, asthma, and immunology specialist for both adults and kids. I have been practicing in New York City for the last 12 plus years, and I am currently the co-founder and chief medical officer of a new telemedicine startup called Cleared. And I am also a teaching professor at Mount Sinai Hospital and also at Downstate Hospital in Brooklyn.
Excellent. Fantastic. Congratulations on everything. And for our discussion today, Doctor, we were eager to pick your brain about allergies. Can you tell us a little bit about the different kinds of allergies?
Sure. I think for today's discussion, we're going to mostly stick to environmental allergies, just because that's really where the eyes are affected. And environmental allergies are essentially allergies of the eyes, nose, skin, airways, secondary to things in our environment. So things like pollen, dust mite, animal dander, mold, all of those things can cause inflammation and irritation to all these different parts of our body. And that's essentially what environmental allergies are. Gotcha.
Perfect. And what common symptoms of allergies can people look out for, environmentally speaking, to let them know, like, hey, I have allergies and I probably need to go get this looked at?
Yeah, so I'm going to go system by system. So for the eyes, you can get itchy, watery, red eyes. For the nose, you can get a runny nose, congestion, sneezing, itchy nose. And then for the airways, and that can also lead to postnasal drip, which can cause an irritated sore throat at times too. And then for the airways, if you have allergic asthma, it can also lead to coughing, wheezing, shortness of breath. And then for some people who suffer from skin allergies, it can also lead to eczema.
Wow. I never knew that. But Dr. Gupta, you've seen a lot of allergies before, like you've seen a bunch of cases, obviously. Is there one that's more prevalent over the other?
So actually allergies of the eyes and nose are very prevalent. In fact, 10 to 40% of adults have environmental allergies, and then up to 40% of kids have allergies. And so it is a very, very common problem. And they say almost 60 million people in the US suffer from environmental allergies, and that number keeps growing. And we think that that's mostly secondary to climate change and the way that our environment is changing, and the increase in pollen counts and the longer allergy seasons. And that's just causing more and more people to become sensitive.
Perfect. And Dr. Gupta, when it comes to seasonal allergies, what's the recommended advice that you give to patients? Like, do you have like a course of treatment that you go through with them?
Yeah, so it really depends on what part of their body is affected. So like I said, the eyes, the nose, the airways, and the skin can all be affected by allergies. And so it's really dependent. My treatment plans are really dependent on what symptoms the person is experiencing. So for example, for the eyes, if people are having those itchy, watery eyes, then we have antihistamine eye drops that people can use. We also sometimes recommend eyelid kind of washes or scrubs, kind of, similar to the ones that OCuSoft makes. And so, and that's mostly to get rid of the pollen and anything that's sitting on your eyelids, because the longer an allergen sits there, the more irritation and discomfort it can cause.
Well, we appreciate the shout out to the OCuSoft lid scrubs. Thank you, doctor. Thank you for that. And doctor, do you know who's most susceptible to allergies? Like, is it genetic, or are there outside factors that we can change?
So, allergies are in fact genetic. And so if you have a parent that has allergies, then you're more likely to have allergies yourself. And there's something called the allergic triad, which is allergic asthma, allergic eczema, and then allergies of the eyes and nose. And those three conditions really go together. So I'm a perfect example of that. I actually have all three of those conditions. And so a lot of times people will have one and then they will also tend to have the other two. And so that, kind of the general outlook. If you have a parent or a sibling with allergies, then you're more likely to have allergies yourself.
Wow, I did not know that. That's actually really great information. But Dr. Gupta, how can you tell the difference between like a seasonal or food allergy? I was always curious about that. How do I know if this is just seasonal or if this is something I ate? How do you can you really tell the difference?
Yeah, so actually seasonal allergies and food allergies are very, very different. Seasonal allergies, like I said, will cause those kind of itchy, watery eyes, the runny nose, the congestion, all of that kind of stuff. And food allergies, you'll know if you have a food allergy because as soon as you eat something, within 30 minutes normally, you're going to have hives, you're going to have difficulty breathing, you're going to have swelling of your face and mouth, and you can even have vomiting. So all of those symptoms happen very rapidly and quickly together. Normally if you have a food allergy. And so it looks very different to environmental allergies, which, happen more chronically. They, you're going to have maybe a little bit of a runny nose, a little bit of itchy eyes, and that can kind of vary throughout the day. It can vary from week to week. And so it really just depends on what your triggers are.
Fantastic. Thank you for that. And Dr. Gupta, I know you spoke about it earlier about some allergies being genetic. But for some people, are allergies something that I have it right off the bat, or is it something that I can develop later over time? I've never had, if you've never had allergies the first 20 years of your life, and then all of a sudden you get allergies the next year. How is that possible? And what can we do about it?
So our immune system is constantly changing, and that means that we can develop allergies at any time in our lives. And we're seeing that as we become more of a nomadic kind of society where people are moving from one location to the other, from the East Coast to the West Coast, those large changes in environment and the body being exposed to different pollens and things like that can make somebody allergic over time. And so changing location, getting a new pet, all of these things can cause somebody to become newly sensitized or allergic.
Dr. Gupta, how often should someone see an allergist? Is it on a regular basis, or is it something like I need to go once a year, my regular doctor, or an OD or an optometrist? How often should I go see an allergist?
So it really depends on how severe your allergies are. If you are suffering from allergies, and especially right now, when a runny nose or a cough can really make people nervous with everything that's going on, I would say that, getting your allergies managed now is even more important than it ever was, so that you're not constantly afraid that, you might have another viral illness, which, again, right now can cause a lot of anxiety. And so I would say if you are suffering, if it's affecting your quality of life, if you've never been tested, allergy testing can be really helpful because then you understand what your triggers are and you can make environmental changes. We can also recommend therapies based on what you're allergic to, like immunotherapy, if your allergies are, bothering you and you want to do something that's more long-term. And so I would say that that at least, for my seasonal allergy sufferers, they see me at least once a year, right before the season starts. And I always tell people to come in before the season starts so that we can kind of create their treatment plan and get them kind of going. It's always better to treat symptoms before they, meaning as soon as they start, as opposed to after they've already become moderate to severe. And then you're trying to kind of catch up and trying to treat them, because then we end up having to use stronger treatments. And so it's always better to kind of preemptively get ready, get set up, know what you're going to take for what symptoms. And even for some of our seasonal allergy sufferers, we have them look at pollen counts, for example, and kind of monitor the pollen counts in their area. And if they know that they're allergic to trees or grasses or weeds, as soon as those pollens start popping up, we have them start their treatment protocol. And so it really just depends on what your symptoms are, especially if you have allergic asthma. It's very important to stay on top of your symptoms. And then, you might be seeing your allergy, asthma, immunology specialist more often, sometimes every 3 to 6 months, depending on the severity of your asthma. And so again, the more severe, the more it's affecting you, the more often you might need to be seen.
Fair enough. Thank you for that information, Dr. Gupta. And are there any new technologies or new developments that are in the allergy game right now that we should be aware of?
I don't know about new, but, I think a lot of times, people don't understand what the benefit of seeing an allergist might be, because there are so many allergy medications that are available over the counter. But, there are multiple medications that aren't available over the counter, like antihistamine nasal sprays, for example. That's still a prescription medication as of right now. I think it is changing, and it might end up being an over-the-counter medication soon. But as of right now, it's a prescription medication, and that can really be a great additive. The other thing is immunotherapy, which I kind of mentioned. Immunotherapy is a way to change the way that your immune system reacts to the allergens that you're sensitive to. So once we do your testing, then we can create an immunotherapy treatment plan for you. And immunotherapy comes in 2 different forms. It comes as allergy shots. So that's something where you might have to go where you will have to go into an allergist office in the beginning once a week to get shots for your allergies. And then it goes to every month after. And then there's also sublingual immunotherapy tablets, which are FDA approved for certain allergens like dust mites, ragweed, and grass. And those can actually be taken from home. So there's multiple options to kind of have long-term effective treatment for your allergies. And I think those are some of the things that people don't realize. The other thing that I'd like to mention is that, even though environmental allergies are not life-threatening, although, allergic asthma really can be life-threatening if it's not well controlled. But, allergies of the eyes and nose and skin aren't life-threatening. They have a huge impact on quality of life and sleep and the way we perform at work. It's actually one of the most common reasons for missed work days in this country. And so I think people kind of, say, oh, it's just my allergies. But again, with everything going on right now, you don't want to have a runny nose. You don't want to have a cough. You don't want to have anything that could be misperceived as, another viral illness. And so we really want to make sure that, there are specialists there that can help you manage your symptoms better. And there are different treatment protocols that really do help patients. And sometimes people are taking all of these over-the-counter medications incorrectly. And so that's something else that we can really help with, is just kind of creating that treatment plan, helping you understand how to use the medications that you've already bought. So I think that, those are some of the benefits of seeing an allergist too.
Fantastic. Well, thank you for that information, Dr. Gupta. And before we leave today, was there anything else that you'd like to tell our audience about?
No, I think that's it. I think, again, now is the best time to take care of your health. I think no matter what condition you have, no matter what's going on, if you don't have your health, you really don't have anything. And I'm saying that as a patient myself. I don't sometimes take care of myself the way that I should. And I keep having to remind myself that that without our health, we really don't have anything. So, go see your doctor. And even now with telemedicine, it's even easier to do that. So if you can't get out of work, you can literally just do a quick visit through your phone during your lunch hour. So there's so many different ways to get healthcare now. And I was just tell people to really take advantage of that and to make sure that they're taking care of themselves.
Excellent advice, Dr. Gupta. Everyone, that was Dr. Payel Gupta from New York, New York. Dr. Gupta, thank you so much for joining us today.
Thank you so much for having me.